From News 8, this is Live Desk Conversations with digital anchor Luke Laster.
Luke, thanks for having me. And the honest answer is it's been a very hard week for everybody, and it's been personal this week as well for us. I've had several family members, not intimate family, not our nuclear family, but who've been ill, one in the hospital. So it's very real, but we're doing well.
Good. And I do want to thank you again as viewers are flowing in now from the Wood TV Live Desk, our first Live Desk Conversations. Again, I'm Luke Laster, joined with Dr. DeHart of Metro Health. Taking your questions live. We did have some that were emailed prior to hand, and I also want to encourage using that hashtag there that you see under my name, hashtag HeyLuke. If you have a question or a comment, we might just take it on screen and we'll be able to answer it. Dr. DeHart will be able to answer it to the best of his ability, and we'll go from there. So for the first one, I want to ask, how is Metro Health holding up as a whole right now with the influx of COVID patients and the rising cases that we are seeing at this time?
Sure. It's anything but business as usual, of course, but we've been preparing for this all year, all summer, and Dr. Hahn, our leader, put out an all-hands-on-deck call back several weeks ago. So we've all been very diligently working on this. The leaders are meeting sometimes multiple times a day as things change. We've increased capacity in our emergency room and our ICUs. And so we have been able to keep up. We stopped some elective procedures that might lead to people being hospitalized afterwards so that we have room. The hospital's about 90% capacity right now, and probably 40 to 50% of those are COVID patients. So we're hanging in there, but we're also been doing really well as far as preparing. We've done over 33,000 COVID tests already this year, and that puts us up there with some of the larger health systems in the state. So we're managing and doing what we can.
We've been seeing a lot of reports of vaccines being 95% effective, 90% effective. That has to put a smile on your face, and that has to make you excited. Within these next few months, these are going to be crucial months as it starts getting, rolled out to people who need it, the public pretty much. How confident are you in that effectiveness and hearing those reports?
Very confident. I think that the manufacturers have been very careful not to shortcut safety, which is critical, but the speed that they've come on is amazing. The effectiveness is very high. So we've been working both here at Metro and regionally in figuring out how we're going to give those vaccines. We know enough about them, how much cold temperatures they need to be stored and how to do that we've already been working on how we're going to actually vaccinate our 3,000 employees here and participate regionally in vaccinating the community.
And another question to 180 off of that a little bit. We are in flu season as well. Big question that we're hearing is flu cases versus COVID-19. This is kind of a loaded question. Can you explain the differences between the two and also explain, where the flu is at versus COVID-19?
Sure. Although I haven't looked this week, so don't hold me to this. There really hasn't been a case of influenza, the actual virus, in the U.S. yet. And we didn't have a lot of influenza in the Southern Hemisphere during their winter. So, that tells us to some degree that the social distancing and things have been working. The flu is a lot like COVID. So from symptoms, it's hard to tell the difference. It's fever and cough and the aches and pains you remember. I think the unique thing about COVID is a lot of people experience the loss of taste and loss of smell that can last for quite a while. That seems to be because the virus starts by infecting the nose and mouth and produces a lot of virus that way to infect other people. But in a number of people, of course, then it goes on into the lungs and causes much more severe disease, and that's when they end up in the hospital.
So I do want to get into some of the viewer questions now that we received via email. We advertised it yesterday evening, and I had some influx of emails. And I also want to remind you to those watching, use that hashtag #HeyLuke there, and I will be able to take any questions again if they are appropriate and relevant to the conversation at hand. I'll be able to display them on screen. We'll be able to answer them. This one comes from, we got several questions about this one, not one specific person, is mask wearing. We've been using masks and wearing them for quite some time. Some states have mandates in place. How effective are these proving to actually be? And why should we keep wearing them? Is sanitation of masks a concern as well? Again, another loaded question, but masks are a big, big question that people have.
Sure. And, the first thing would be that we've been using masks in hospitals for years and years, because there's no question they're effective. I think there's no question when studies can be done in communities that they decrease the risk of transmission. I think one of the reasons that this becomes controversial is that there is absolutely nothing that's perfect, nothing that's safe. Things are safer. So what we always emphasize is that masks are just one thing we can do to help protect others if we're infected and don't know that we're out in the community. We actually wear them more for other people we're around than we do for ourselves, but they do work, but they're only one thing that we do that's going to decrease the number of cases and protect our community. And as far as sanitation, just simply washing them periodically. I mean, some people say wash them every day. We're all humans, we forget to do that, but washing them periodically is all you need to do, and that works well.
Another question we had, this one is from Nancy. She says, this one's a little more specific. I know we've been kind of hitting on general questions, but she says, if my son had COVID 5 weeks ago, will he still test positive, and can he still give me the virus?
That's a great question. So I can give you some very, very good data, very good guidelines on how to manage that. As far as testing, we don't even test for a quote cure in the healthcare setting, because we know that some of the tests we do can pick up particles of the virus that aren't infectious for weeks and weeks after somebody's had COVID. But we also know that they're really only infectious for up to about 14 days at the most, and much more earlier on in the illness. So there's no real need to do a follow-up test. And as far as being around someone with COVID, after about 14 days, they are really not infectious any longer.
And this one, I guess, along the same lines, knowing that now and having said that, our next question was from Patricia, and she said, what do you do, what to do after you have COVID-19? Is it safe to prepare food for others? Is it safe to be around others who are post-COVID? And will I get it again? Can I be a carrier?
Sure. Great questions, and lots of them, so help me if I forget one of them. But preparing food is relatively safe. We don't really know that there's any significant risk of getting COVID from food. So getting takeout food, things of that sort, is very safe to do. Washing your hands and wearing a mask if you have COVID and you're preparing food would make sense. But after that 14 days or so, there's really not any significant risk, and food is probably a very safe thing to do. I'll refresh my memory on the other ones.
I think that's a great answer, especially when we're in food preparing season, with Thanksgiving right around the corner and Christmas.
Sure.
So the second half is will I get it again? Can I be a carrier? Are they more, susceptible?
Yeah, and that's a great question as well. And so there have been a couple of reports of people getting COVID a second time. But the important thing would be that that's been so rare, they end up getting reported worldwide. So it is possible, but it certainly would take time. You should have good immunity for a while. So you're not likely to get it again. And you're not likely to give it to anybody else or carry it after that 14 days. So you're not a carrier like you might be for a strep throat or something of that sort. No. So after the 14 days, you're safe to be around your friends and family.
And we actually had a few questions along those lines of post-COVID, and once you have it, how likely are you to pass it along to any extent? We had just a question literally minutes before we streamed. If someone had COVID this summer and recovered, can they contract again, be asymptomatic, and be a carrier? Essentially had answered that about that 14-day period. Is there anything else, along those lines?
No, I don't think so. I think they can safely assume you're not likely to get it again, and you're not going to be carrying the virus from that episode. So once you're over it, you're cured.
And then, so we had another one. This is a little more along the lines of places that are open right now. This one comes from Kate. It says, why are we seeing an increase in retail stores capacity in Michigan? This seems to be a high-risk situation for COVID as Black Friday approaches, which a lot of places have gone online with Black Friday and said that they are canceling it. The parking lot was, where was that? We are seeing things like high schools closed and encouraged to not participate in big Thanksgiving dinners, but increasing capacity in retail, this seems very unsafe. And I actually want to elaborate on that real quick as well. I went to go get takeout the other day, and I drove by a mall, and it was packed. There was a lot of cars, and there was a lot of people walking around. Where's the line drawn, I guess, in that situation from a medical standpoint?
Wow, and that is a great question. I mean, one of the reasons that we encourage people to be so careful about mask wearing and thinking about social distancing is so that we don't have to shut down the whole community. People need to be out and shop and get food, and our economy in our area needs to survive. So we just all need to play a part and be careful when we're out in the community like that. Now, restaurants are a little more concerning because you're taking off the mask to eat in the smaller area. A large area like a mall that has a lot of air circulation and everybody's wearing masks is certainly a little safer. And when I have gone out, I've noticed most stores are trying to limit capacity. And of course, I don't know all the details around that, but that is critical, and it's going to be hard to do through the holiday season.
Excellent. And so we actually had a couple come in, not via our live stream, but I'm looking at my inbox at the moment. This one comes from Catherine. It says, if a coworker is showing symptoms at the office, but no one is around, can other employees still be at risk? And I think that's a great question by the fact that a lot of people are working from home right now, and there are specific individuals who still go into the office, and they're often not surrounded by others.
Sure. So if I understand the question, Catherine, I think that the issue is that when people are around each other in smaller spaces, that's where the risk gets higher over time. 15 minutes, half an hour, that's where virus is going to be able to increase just in the air. So even here at Metro, we've been working very hard for anybody that can work remotely, is working remotely, to try to decrease the amount of people that might be sitting in an office together, and we're wearing masks. So I think you can do things to prevent that transmission, but I do think you also need to think very hard about it. If you're in a small office or a call center with other people who are sick, that is a high-risk situation, and you need to think through how you can be safe in that situation.
And there was another half of that question as well about thermometers. We see now when we just go into the doctor's office just for maybe a urgent care type situation that's not really related to COVID, and they scan, your forehead. Can you talk about the question is about accuracy between those thermometers and oral thermometers? Can you explain that a little bit?
Sure. they're not tremendously accurate. And I don't think that is always a very helpful thing. At the hospital and our clinics here, we tended to go toward doing temperatures when people are in the room. I think to some degree, you just simply have to trust people to tell you if they're symptomatic or they've not felt well. But we also had experiences in the spring when we were doing that, and people were coming in from outside and their temperatures were so low, they had to sit around for 15 minutes before they warmed up enough to use them. So those are not all that accurate, and I don't think they're a very helpful way to manage that.
Gotcha. All right, thank you, Catherine, for those questions, and Doctor for the answer as well. We do have one here in our Facebook feed that I'm going to publish right now. I believe that one is up. It is on screen. This one is from Janice. She says, hashtag, hey Luke, can you ask if someone had confirmed COVID and now has recovered, is there any need for them to wear a mask? And we've talked about those recoveries, but yeah, that is a question from Janice.
Sure. So although it's rare, we do know people can get COVID a second time. Multiple case reports about that. And it's your risk, of course, of infecting someone if you've had it and recovered is very low, but it's also just a community issue. So I think that you would understand that's low, but everybody that you're around and interacting with would not. And also, though we don't have any flu circulating, we certainly have cold circulating. And if someone caught a cold from you or you caught a regular cold from them, that's going to impact their life significantly right now as they have to get tested and isolated. So I still think it's a wise idea to do that.
Awesome. All right, thank you, sir. And thank you, Janice, for asking that question. I'll publish that one now. Again, if you have any other questions, we are taking them in this live stream here from the Wood TV Live Desk, our first Live Desk Conversations. Today we're joined by Dr. DeHart of Metro Health, infectious disease physician over there. Is there, as we wait for maybe a couple more questions to flow in here, these next couple months, we hit on it earlier on in our conversation, are going to be very, very important here. We're getting word of a vaccine coming out, and we're in prime season of large gatherings. Just can you elaborate a little more on how important it is to maybe rethink these gatherings, as we've heard from the MDHHS about in those weekly press conferences we'll usually hear from Dr. Khaldun, things along those lines?
Yeah, it is a very, very important, very difficult conversation. Of course, I can just tell you personally, from our point of view, those family members who recently had COVID, one in the hospital, we would have gathered with them for a large gathering to eat too much and watch the Lions lose. There's just certain traditions we all have, right? So we realized back probably a couple months ago that large gathering was probably not going to be a good idea, but we were still hoping to have several family members over. And we just had the hard conversation the other day that each of those people, my adult children, have bubbles of people that they're around, that they interact with, and there's some risk. And so we also have family members who are compromised. So I think everybody has to sit down and have that hard conversation with their family and say, are there people we simply need to protect? And can we be sure about where other people who would be coming have been and whether they may be asymptomatic, and just what level of risk are we willing to take? And then think of creative ways to celebrate Thanksgiving and love each other and be thankful without necessarily having as many people in the house, which is a significant risk when you're all together in a small house. If we lived in Florida, we could be outside, but welcome Michigan.
And actually, as you say that, we're getting our first snowfall. It's literally snowing as we speak, so it's kind of worked out like that. So we do have another question here. I will publish this one. This is from Philip. Again, on the mask wearing. That was majority of the questions that we got overnight in my inbox, and it seems to be a big one here in our comments as well. This one says, let me make sure that published really quick. There we go. That one's on the screen. Thank you, Philip, for asking. It says, hashtag, hey Luke, what would need to be said to the people who refuse to wear a mask, or better yet, wear their mask only below their nose. Now, if you could just again elaborate on the importance of mask wearing there, is kind of, I believe, where the angle of this question is.
Yeah. So, I mean, we've all been out and seen that where people are wearing a mask or it's down under their nose, and the virus is the most at risk when it's in your nose and mouth, and this virus lives there, it reproduces there. So that part of the mask wearing just makes scientific sense, and it's been proven to work. I know that there are a lot of reasons why people won't wear masks, but I mean, just personally, when I think about it, I would rather, just the idea of my rights being trampled on, I would rather do something as simple as wear a mask than put anybody that I'm around at risk. I know they work, and I know they're important, and there just isn't anything from a moral, ethical, or religious point of view that could possibly justify saying, I'm not going to wear a mask so that I'm not trampled on. It's just, we live such wonderful, privileged lives. It's a small thing to ask. It's a simple thing to do, and it just seems the civic thing to do to me.
Gotcha. Thank you, Philip, and thank you again, Doctor, for answering that. Appreciate that. I'm going to unpublish that one now. Again, if you have any other questions, I think we're just about to wrap up here. One question I do want to ask, and one thing I want to keep asking, medical professionals such as yourself and guests that we have on this show, I want to end on a high note. Tell us something good, please.
Well, I think we can clearly say this will pass. I think it's going to be a hard couple of months because this is a time when we all just desperately want to be around the people we love, and it's going to be hard. And I'm feeling like the Grinch here who stole Christmas, but we just simply need to get through these next months or two. When we'll come out of our cocoons in Michigan, we'll have vaccines that will begin to be effective, and things will get better. But, on the positive side, the positive things we've seen about people stepping up and responding, helping each other, Metro Foundation funding extra child care over at the YMCA for nurses and healthcare people that are coming to work because it's a calling. It's not just a job for them. They're here for the community, and they need help with child care. People just stepping up to do jobs. A highly skilled nurse in an OR said, oh no, I'll go stand outside in the cold and do COVID tests for 8 hours because that's what needs to be done. And we're just seeing that everywhere. So we're seeing a lot of the best in people stepping up for one another. And that's what's going to get us through. And I think if we get through these next couple of months and just say, we're going to do this, we're going to get through this, things are going to be a lot better, a lot different in 2021.
That's a great response. The sun is shining on the horizon there. All righty. Thank you, sir. I do appreciate it. Again, we're going to wrap things up now. Thank you for those who asked questions ahead of time and in our stream. Doctor, thank you very much for taking the time out of your busy schedule to chat with me. I'll ask you just to hold on for 1 second. I'll end the stream, and then I want to chat with you again real quick. But ladies and gentlemen, thank you for tuning in to our first live desk conversation here. I'm Luke Lasser, again joined by Dr. DeHart of Metro Health. Have a great afternoon. Stay healthy, and still coming down out there. Enjoy that first snowfall.